The healthcare industry is embarking on a major shift in reimbursement. As with anything in our evolving field, confusion, anxiety, and indifference often coexist with so much change. But you can rest assured that Aegis Therapies is your resource and can help guide you to success in this new climate. Let's begin with the basics. Patient Driven Groupings Model, or PDGM, is the new Medicare payment methodology for home health agencies. It takes effect on January 1st, 2020. In the current payment methodology, there are 3 fundamental reimbursement components. They are clinical, functional, and service. These variables are largely determined by information found in the Oasis, and the service variable is based on the number of therapy visits delivered. Under PDGM, therapy visits no longer contribute to reimbursement. Instead, a patient's home health episode will be reimbursed based on the patient's characteristics. That said, PDGM has 4 fundamental reimbursement components: admission source and episode timing, clinical grouping, functional impairment level, and comorbidity adjustments. It is important to note that PDGM represents a movement away from the volume of services driving reimbursement toward paying for patient characteristics and conditions. Now, let's dive into those specifics. For one thing, payment will move to 30-day payment periods inside of a 60-day certification period. However, Oasis time points are not affected. In addition, there will be 432 individual case mix weights, or codes as determined by each patient's categorization into the 4 groupings. And each of those 432 HIPS codes will have an individual LUPA threshold. Keep in mind that implementation of PDGM was designed to be budget neutral to CMS. As part of this budget neutrality, CMS is assuming that overall, home health agencies will make 3 behavioral changes with the implementation of this new payment methodology. So, what are these assumptions? Agencies will change their documentation and coding practices to get a higher paying clinical group. They will also capture additional applicable ICD-10 codes to obtain comorbidity adjustments. And finally, agencies will add 1 or 2 extra visits to avoid a LUPA designation. What's next, you might ask? You should start by taking an in-depth look at your agency and determine how you can maximize your thoroughness of diagnostic and functional coding and measurement skills for nursing and therapy clinicians. This is imperative because the success of your agency will depend on your ability to remain agile and effective without compromising patient care and outcomes. And as always, remember that Aegis Therapies is here to support you through changes as your PDGM resource. Keep up to date on our Resource Center.